Core abdominoplasty. The core is a terminology that is very popular these days, especially for the ladies who do the Pilates. You know that everybody talks about the core. Keep your core tight. Push your abdomen in. So the emphasis is that if you keep the muscle of the abdomen tight, your whole body is going to change. When we do the abdominoplasty, one of the components of the abdominoplasty is muscle tightening. Traditionally, the muscle tightening is done by running the suture from midline of the abdomen from the top to bottom to bring the muscle together. We call it repair of the diastasis. Diastasis is the separation of the muscle that happens usually after pregnancy. Why do I call it core? Because I find out that if you do not evaluate the person in the semi-sitting position after you repair the midline, you are not going to be able to tighten that muscle adequately. I learned this in the hard way because one of my patients came back after surgery and said, I have a still bulging of my upper abdomen. And this is the person that I saw that weakness at the time of abdominoplasty when she was in the sitting position. So what I do after I repair the midline of the abdomen, I do table tilt test. Table means that the operating room table is tilted to the sitting position. The hip is flexed, or like a 45 degree. They are under anesthesia and the muscle should be relaxed. Table tilt test cannot be done if you're under the local anesthesia with IV sedation because the muscle is going to be tight. Then you look at the muscle, you see where the weakness is, where is the bulging is, you mark them and then you repair them again by tightening the fascia with a permanent suture. This could be up and down, could be side, could be oblique direction, could be transverse direction. This is a must for the people who had especially twin pregnancy, multiple pregnancies in the short period of the time, and the young people who come to you and they have a very bulging abdomen with the distorted shape of the umbilicus because everything is pushing outside. So the core abdominoplasty means that make that muscle of the abdomen back to normal like before pregnancy. How to evaluate them is by table tilt test, and then you mark them and you go ahead and you repair them. So these people, when they come back, you tell them relax your abdomen, tighten your abdomen. There is no more difference because the abdomen is back, and I tell them you don't have to do any more sit-up. You don't have to put your core back again because it's tight there forever. This is only done for the young, healthy ladies. Heavy person, older person, you cannot do the core abdominoplasty for them. It's not safe for them. So that's the core abdominoplasty.